Good evening, everyone. Welcome to the 159th webinar on diet advice to patients with diabetes or pre-diabetes and dyslipidemia. We welcome Dr. Simi Khanna, who is a BSc and PG in dietetics and food service management, IBS from Monash University, Australia, and she is a diabetes educator from the American Dietetics Association. We welcome you, Dr. Simi.
Yeah, okay, I can do it now.
Yes, doctor, we can start. I'll just stop sharing my screen.
Yeah, just give me a second. Is my slide visible?
Yes, doctor.
Yeah, okay. Hi, good evening, everybody. And as we are going to discuss on today's topic, it's the nutritional management of pre-diabetes and diabetes and heart diseases. And we all know that it is one of the most common diseases, or I can't call it as a disease, but I'll call it as a disorder, a lifestyle disorder, which is leading to these non-communicable diseases. Uh, the introduction has been already been given by Preeti, so I'm not going to go in for that. But definitely, I would like to discuss about the new word which I believe in. So lean is something that is a new word that I teach all the people in and around me. When I talk about L, that is the lifestyle habits. I teach people what is circadian rhythm and why is it important to, very important for us to follow this is because so that we don't go for more problems in life. Then E is for exercise. Now, depending upon the person, what profession they belong to, and how much time do they have, exercise is very important. Attitude, that is the way we think, is very, very important. And N is the nutrition. So, this is something which I believe in, and these are the four pillars which I teach my clients to follow when they are having any kind of health issues. Now, when we talk about pre-diabetes or diabetes or obesity or any kind of non-communicable diseases, the four pillars that I teach mostly for pre-diabetes and for especially for diabetes is there are four pillars, but the most important is the diet. Second is the physical activity. Third is the education, educating the person going through this disorder as to what and how they should lead a life. Because the moment the person comes to know that they are pre-diabetic or they are diabetic and they feel it's the end of the world and they'll not be able to eat anything that they love to eat, so they are very, very upset about it, and that makes a lot of difference. And many a times, even the notions that we have been hearing since a very long time, that stop eating rice and stop eating potato and stop eating mangoes and stop eating all the sweet fruits. This is the common myth which is there among most of the people even till today. They don't know that they can be eaten if the diet is planned by a qualified dietitian. Now, when I say a qualified dietitian, I would always request people or the doctors to understand where the degree is from. At least a BSc basic degree, an MSc or a postgraduate is very, very important when you are referring to somebody or when you're going to somebody for your diet consultation. The WhatsApp University and the Google always doesn't give the right information. It's the information that's not been updated for a very, very long period of time. Then comes the medication. Now, in certain conditions where the patient is suffering from a lot of disorders, then yes, medication is also needed by the person. And these four pillars, when you combine them together, you can see that the results are much better. And many a times, the pre-diabetes we can even bring back. We can remediate it. It's better that we explain the people how we can reverse it in a very easy manner by enjoying the food that is the most want of everybody in today's life. uh, before I begin with the other things, the most important for pre-diabetes and diabetes is to understand the difference between the glycemic index versus the glycemic load. So when we talk about glycemic index, what is glycemic index? It's actually also known as GI in short, and it is the effect of food or whatever you're eating. It converts into the blood glucose levels. So any food that you eat, every time the response will be different of that glycemic index. So when we talk about glycemic load, so when we use the glycemic index with a certain amount of carbs or for a specific food to estimate how quickly a food can cause a blood sugar levels high when you are eating the particular food. So the next graph, what I would like you to see is, you can see that the red graph is the graph where whatever you're eating, if you eat a high glycemic index food, the blood sugar really rises very quickly, and within 30 minutes you will see that the sugar level is falling down. So the faster the glycemic index is up, the faster it will come down. Say, for example, if for breakfast you have eaten something like an aloo paratha. So when we eat an aloo paratha, you'll see that you really feel full at that particular time. You're really stuffed, you're really heavy. But then within an hour, you feel that no, I'm still hungry. I still need something else to eat. So this is the example for high glycemic index food, because it's wheat and it is potato. So both belong to a higher glycemic index food. Then when we eat something like a lower glycemic index food, you will see that the blood sugar rises really very slowly, and then you will see that the graph is like really maintained. You don't see that big fluctuations of graph on that. So, say for example, if you're eating an aloo paratha, then I would say with the aloo paratha, in the atta, you can mix maybe a rajagira or a jaw, that is a barley. So you will see that when the wheat and barley, when they are mixed, barley is from a lower glycemic index. It has more of fiber. So you will see that the same paratha and the aloo ke saath mein, you can even add another vegetable, and the best vegetable that goes along with it is maybe a raw papaya, or you can even have a cabbage if raw papaya is not liked by someone. So then you will see that the glycemic index will really remain on the lower version, because you're taking a lower glycemic index foods. Now, when we talk about glycemic index, you'll see that 0 to 55 is where you need to tell people that when you share this graph, when you share this sheet with the patient or with the client, it makes their life more easier, because then they have so many options, and they are aware that even if they are traveling out, what they are supposed to eat and how do they choose as to what they can eat so that the blood glucose levels are maintained. So if you see 0 to 55, it's the category of the low glycemic index. 56 to 69 comes under the medium or the moderate glycemic index. And then comes the high glycemic index, which is above 70. So there was a lady who was coming to me since a very long time, and when I it's a always a ritual to ask the history as to what their routine is. So she loved eating upma. Now, when you upma is something that is rava, it is processed, so that's really going to be of a higher glycemic index. And if you see it traditionally in India, every breakfast what we eat is full of carbs. So whether it is aloo paratha, whether it is upma, whether it is poha, or whether it is thepla, or whether it is a bhakri, there is nothing like a protein in it, or there is nothing like a lower glycemic index foods that we include so that the blood fluctuation levels don't take place. So when you are making an upma, you should see, say for example, if the upma is like say one katori, explain the patient that take the vegetables too in concern with that, and either you can add maybe a soya granules, or maybe you can add sprouts separately, or you can add a pumpkin seed podi, very easy to make. So these are something, even if it's a working person, and when you give these small tips to them, it helps to make them feel good, and it's like they're not deprived of eating anything that is important for them as a whole breakfast. So even if you're making a poha, you can add peas, or if you don't have any cholesterol issues, you can add peanuts in it. Maybe a little broccoli can be added. So that is really very important, that what are you suggesting so that their blood sugar levels are maintained. Now, many in the recent research by the ICMR, it has been noticed that whenever we cook anything, the glycemic index changes. Now, I'll be explaining in the further slides how the cooking is changing the glycemic index of the food. Now, many a times, ragi. People consider ragi as the richest source of calcium, but if you see, it's not good for pre-diabetic or diabetics, is because it's a myth. You'll see people eating, instead of wheat, they are taking either a jowar, or they start taking a ragi. But ragi comes under a high glycemic index food, whereas ragi is like, say, 84 is the glycemic index. It's really on the higher side. So, of course, yes, it's the richest source of calcium, but the fiber in it is very, very average. So, what we need to do, we can't tell the person that don't eat ragi, so we can teach the person how the ragi can be eaten. So, like I always tell people that if you're buying the ready packet of ragi from the market, it's mostly a little bit on the sweetened side. So, what normally people do is people add it in the dosas, or maybe they add it in the porridge. So, instead of making that, if they can use vegetables along with ragi, and add a pulse along with it, like, say, for example, you want to make a ragi dosa, then you can add a little ragi and you can add urad dal. So it becomes a good combination, because urad dal again is protein. It's going to be of a low glycemic index. It's not going to allow your blood sugars to level up. And then, of course, you're going to add vegetables, which are already of the low glycemic index. When you talk about barley, now barley is really very nice when it comes to pre-diabetic and diabetic. So I say people, the fad what is come nowadays is stop gluten completely. Now, unless and until you have an IBS issue where you've been diagnosed not to eat gluten, then that's the time when you stop eating wheat. Otherwise, I would say keep continuing the wheat what you are eating, and just add another flour along with it, which is of high fiber. So if you see, the barley jaw is a good glycemic index is just 37. So it's a low glycemic index because it has really high fiber in it. In comparison to that, even if you can say bajra, it's of an average glycemic index again is 49. So again, it comes under a low glycemic index. Wheat, of course, it comes under the moderate version. So when we combine the two things, we can always do. The latest what wheat that is going on nowadays is the kapli wheat. So if it's not heavy on your pocket, you can go in for kapli wheat. So kapli wheat is another thing which already has a starch, but it has fiber along with it because the bran has been kept, and that is something which helps to stabilize your blood sugar levels in your body. Now, when you talk about rice, so whatever, most of the time people eat basmati rice. Now, basmati rice is something which, like, it's really polished. So I would suggest that if you're eating rice, eat the local rice, what is available in your city or in your state. And in the next slides, I'll be teaching you how you can eat the rice also, though you are a pre-diabetic or a diabetic person. Now, as we were discussing, what how cooking affects the glycemic index. So, any starchy foods, say for example, if it's a rice or a pasta or anything regarding with noodles, when you cook it for a longer period of time, it increases in the glycemic index. So I'm just sharing a small example with you of a South Indian lady who was coming to me, and she was very, you can imagine it's South Indian, so definitely in South, rice is something which is like really they can't live without it. And if you tell the person that you can't eat rice, so you can imagine how the person will be disheartened. So when we checked her portion plate, we saw that she was taking a lot of rice. See, because when we teach the person how to eat in moderation, or when we teach them the portion size is really very important, and it is one of the easiest method which if one can follow, it becomes easier even for obesity. You can see that there is a good result and you lose a lot of fat. you'll have a lot of inch loss, and you'll see to it that the weight, whatever you lose, will never come back again. Now, when we talk about another cooking method, that is steaming, or maybe a moist cooking at a temperature of maybe 50 degrees centigrade, you will see that the presence of water, it increases in GI due to gelatinization of starch. So, say for example, carrots. Now, carrot actually in nature is a low glycemic index food, but when you boil or when you cook the carrot or the beetroot, it goes off a higher glycemic index food. So, as far as possible, I've seen many a times people making carrot, they boil it or they steam it. So, better than that, it's to have it in the raw form and the salads form. You can either grate it or either you can cut it into thin slices and have it. The beetroot is always steamed. Now, I always tell people when you are going to steam it, it's going to go off a higher glycemic index. So, what you can do is you can grate it and put it in your raita so that it becomes like the raita also goes pink, and it's easily, you can take it with a good combination of probiotics. Sweet potato, on the other hand, when you boil it, it decreases the glycemic index. But when you are frying it, when you're baking it, or when you're roasting it, the glycemic index increases. So sweet potato is one like a life savior for people who are suffering from pre-diabetic and diabetic. So in case if you all are doing any kind of a workout or you're exercising, this is one of the best post-workout meals that one can have. So sweet potato can even be made like a chaat and have it, or maybe even you can use it in your rotis, or maybe in your parathas. So that is something which is a very good meal after the post workout. When we talk about acidity, the more the acid the food is, the lower is the glycemic index. So if you're trying to have some, suppose you're in a restaurant and you're ordered something like which is really heavy in the cooking method, like maybe it's a makan wala sabji, or maybe it's a sabji where there's a lot of fat or oil in it, try squeezing in a lime, or start or take a lime water along with the meal. Then you'll see to it that the glycemic index goes down and your sugar is stable. So even if you're eating out and you have no option, always look for acidic drink along with it, preferably a lime or maybe a tamarind water if available, like you get it in the form of amlana or imlana. So when you take that, it really helps to stabilize your sugar levels. um, when we combine anything with the when we eat something with a high glycemic index, that does not mean that we just cannot eat it. Now, I've just given an example that when we eat a rice and rajma, so rajma is one of the superfoods. It's a good quality protein, and protein really makes the graph go very very slowly. It does not allow the graph to like really boom up. So take 2 katoris of rajma and 1 katori of rice. So if you teach the person in the form of portion sizes, it becomes easier to tell them in the form of grams. Now, many a times you're in a place where you can't measure it in grams, and I don't believe in the gram system. I would rather believe in the portion size, because each katori or each glass has an ml and a gram value against it. Now, say for example, if you're having paneer, so paneer, when you take a paneer tikka, for example, so paneer tikka, if you have it, it's going to be like of a moderate glycemic index, but when you combine it with vegetables, it again comes under the low glycemic index. Now, the easiest and the best part, what I teach people is follow the principle 50, 25, 25. That is the latest research that talks where pre-diabetes can be free of diabetes. They can reverse it back. And if you're a diabetic and if you follow this principle, trust me, your life becomes really, really easier. So what you need to do is, say for example, if it's a plate, it's a round plate, divided into half. So when you divide it into half, that's the 50 rule. So 50 rule is either the raw or the cooked vegetables should be your 50% of the plate. So when you look at the plate, you should see that the half the portion of the plate should be of either a raw or a cooked vegetable. Try taking in a lot of vegetables. Normally in India, our traditional thalis mein, what we do is we take 3 chapatis, and we take a very little quantity of dal and a very little quantity of rice, sabji, and then we try to eat it. Or if we are taking a rice, then we try to put the rice in the center of the plate as much as we can, and just pour a little dal, or maybe a little rasam, or maybe a sambar on it, and have it. But then that will not help you to reverse back, or maybe stabilize your sugar levels. So the best part is learn to divide this plate. Then you'll see that the 25% you keep it for proteins. The proteins have to be there in each and every meal. So when I say each and every meal, I mean to say it has to be in your breakfast, it has to be in your lunch, and it has to be in the dinner. Now most of the time people who are working, they don't have time to cook, and mostly maybe it could be either a roti sabji or maybe a roti dal. So what happens is the meal plate is not uh, complete, and many a time salad is something which is not liked by all. So depending upon that, I keep on changing. I have got varieties of salads which I can give it to people to have, and even salads can be one of the meals if it has proteins in it. Now, the other 25%, it should be from your grains. Now, carbohydrate should not be neglected completely because it's not healthy, but you need to see that the carbohydrate is also needed by the body, because it's very important. For good quality carbs are also needed by the body. So this is, if you follow the principle 50-25-25, your life really becomes very easy. Now you can see a small glass of water on the side. Now many a times people don't understand that water is free. We don't have to pay anything for the water, but it's not been taken seriously. And if you see to it that if today the work culture is there where you're working in ACs, or maybe you're staying in a state where there's a lot of the weather is does not permit you or does not make you feel thirsty, but please see to it that whatever season you are in, especially in winters, you need to watch the water what you're drinking, because 65 to 70% of the body is made up of water, and water is something which is really neglected by people. And many a times you get false hunger pangs, but if you drink a glass of water, it really helps you to neutralize the hunger pangs. So 250 ml, at least 8 glasses for a normal person. Of course, if the person is having any kind of kidney issues or any kind of other issues, then the water needs to be controlled by the doctor or by the qualified dietitian. Otherwise, if you're exercising also, the water quantity keeps on changing. So if next time when you're feeling a little lethargic, or if you're feeling a little tired, just see to it that you drink a glass of water, and you will feel the difference because the brain gets hydrated. Um, then when we talk about the recent ICMR thing is, how do we reverse the pre-diabetes, or how do we help the diabetic patients not to turn on to insulin, and how can we help them recover from this disorder? I wouldn't call it as a disease, but I will call it as a disorder. So typical Indian diets, if you see, 60 to 70% is made up of carbohydrates. India is deficient in proteins. Only 8 to 10% grams of proteins are eaten by a person. And fat, a good quality fat, how do they include it is not known. So if you want to reverse the pre-diabetic or the diabetic, I would suggest that proteins need to be at least zero point 0.8 to 1 gram per body weight. And you will see that I will teach the combination so that it's like a takeaway message for you, so that you can suggest it to the people who are in your family, or maybe your patient or your client, how to include proteins. Now, as we discussed, we have to ensure that the protein requirement should be zero point 0.8 to 1 gram per body weight. That's the ideal weight. Okay. Include protein in every meal so that it does not allow the glucose levels to, like, rise up and come down. Include a good quality protein like a cereal pulse combination. So what amino acid is missing in rice, there'll be another amino acid which is missing in the dal. So when you combine both, or you make a khichdi, or you make a rajma chawal, or any kind of a dal rice, you'll see to it that the diet is like really complete. Now I have just given a few examples that what how can you include protein in your diet, especially at the breakfast, because it is said that you need to eat your breakfast like a king. You need to take your lunch a little lighter than that, and your dinner just like a pauper. So if you go to see, you can have besan chila. Now when I say besan chila, I am talking about with lots of vegetables in it. The thumb rule means if you're adding a protein, add a fiber along with it. Now you can have a mixed dal dosa, you can have a yellow moong dal dosa, you can make paniyarams from different kind of dals. If you're eating an egg, if you're a non-vegetarian and you're eating an egg, then I would suggest you to take in more of egg white and less of egg yolk. It's not like the egg yolk is not healthy. It is healthy, but it has a lot of fat in it. So we need to control the fat. And if you eat a lot of egg whites along with the vegetables, like you make an egg white vegetables omelette, you'll see to it that the protein quality, what you get in it is really very nice. And you'll see to it that you will not feel hungry, or you will not go in for any kind of cravings or any kind of binge eating. Sattu or jaw sattu is something is like a go-to meal for all the people who can do it. If you don't have time for anything, you can either put it in lime water and have it, or you can even take it in coconut water. So this is one of the easiest way to include protein, because it is a very high protein uh, are there in the sattu or the jaw sattu. Now, best thing is always have a probiotic after your breakfast. So you can add a curd or a buttermilk along with that, so that you get a good bacteria in your gut, because everything starts from the gut. So your mind and gut are interrelated. So this is something which I would recommend people to have it. Uh, the buttermilk or the curd along with the breakfast that you're taking. As I've already shared it in before, how to have the upma and the sprouts along with them. Now, the next is I call it as the unsung hero of the diet plan, because in India, nobody bothers about the fiber. It is something which is not taken into seriously into consideration, but this is one of the most important meal for any, if you're looking for a weight loss, you're looking for pre-diabetic reverse or a diabetic reverse, or bringing your LDL down or your cholesterol down or your triglyceride down. Fiber is something that helps to control your blood sugar levels, because it delays the stomach lining, retarding the entry to glucose into the bloodstream and lessening the post meal rise in blood sugar. So, the easiest way is I teach people how to eat food. It's the food order. So, first eat a good bowl of salad, then take in your proteins, and then take in your vegetables with a chapati. And trust me, you will see that the levels of the sugar will be maintained, and very soon you will see that your body starts improving. Now, most of the time, there's a confusion as to how much fiber do we need. So, for people with diabetes, at least 25 to 50 grams of fiber is recommended every day. If you ask me, I would say that add protein and add fiber in all three meals. And it's very easy to add. You can even make a one pot meal. But most of us, we consume only not even 15% of fiber daily. So, there is two kind of fibers, that is a soluble fiber and the insoluble fiber. So when we eat something with, if you're eating it with the skin, like most of the times I've seen people eating apple without the skin, it doesn't make any sense. So you start taking apples with the skin. Many a times I've seen people having orange juice or maybe a mosambi juice, and they're very happy along with it. Then I say, don't do that, because you need three oranges to make one glass of juice, and what you're taking is just simple sugars, that is fructose. So it is better to take one orange, you eat it, you have fiber in it, and you chew it. So it's always better to have that. Always try to choose in a whole grain atta. Nowadays you get a different kind of millet pastas and cereals. Now brown rice, if you like it, you can have it, but if you ask my opinion, I am not much in a favor of brown rice, because very difficult to cook, you don't like the taste of it. So if you can understand the portion size of eating the white rice, then that's one of the best things you can do. Most of the time, how do we add the seeds in our diet? Like I tell people to add maybe the flax seeds, the roasted flax seeds, just powder it and put it in your dahi, or maybe in your cereals or in your curry or on your salads. So it has a lot of omega 3. Omega 3 is really good for your heart issues and even for your body otherwise. uh, you can take a handful of almonds. Now, when you are a pre-diabetic or a diabetic, I would suggest always soak your nuts and seeds, because then it's easy to digest. It's not very heavy on the gut to digest, and it gives you more nutrients when you are having the soaked version. Uh, Now, many a times in India, we see that we begin our day with a chai. So I always tell people, when you get up, take a 300 ml of water, keep a glass of water in near next to your bed. Let it be a 300 ml glass, and I normally recommend people to either put it in a steel glass or a glass, where not in a copper vessel, because unless and until you can see the copper vessel, you can see the glass where your hand goes in, because it's very difficult to maintain a copper vessel. So it will create more toxins in your body. So if you can maintain the copper vessel, then I don't mind taking it in that. But otherwise, for a layman, where they already do not have time for all these things, and I would prefer them to have it either in a steel glass or in a normal glassware, a 300 ml of water. As soon as you get up, start drinking that water. Then I would say that uh, it's seen that when you have the fenugreek seeds soaked in water, it helps in bringing the stabilizing the blood sugar levels. Cumin seeds also are very good for the gut. It neutralizes your acidity. It boosts your immune system. And because it's winters, amla is in the market, and I feel amla is one of the best superfoods that you can start eating. If you can't eat it, then you can at least take it in the juice form or maybe in the powdered form with a handful of soaked nuts. Now, I've just shared a sample menu for you to understand how the diet for a pre-diabetic or a diabetic or obesity or maybe a cholesterol, more or less, it's the same thumb rule that applies to all. So you can either have a vegetable paratha. So when I talk about vegetable paratha, it could be a gobi paratha. Now, when I say paratha, it does not mean that you need to, like, put a lot of oil and on the tawa, or on, make it with ghee and have it with your butter. But I would just ask you to put a very little of, brush it with a brush the oil on the paratha, and then roast it on the other side. You can even have vegetable dalia. When you're talking about vegetable dalia, you can add a yellow moong dal in it for it to give it proteins. Or maybe in this season, it's very easy because you can even add peas. You can add soya granules. You can either have one egg with one or two whole wheat toast. Now, Dr. Asrani has already posted a lot of reels about which bread you should take and which bread is good. So I normally tell people that whatever you're taking, if you don't have an option for a whole wheat bread, if you're taking a white bread, see to it if it's of a high glycemic index food. So learn to art to bring the sugar levels down. So take, instead of single layer of vegetable, add a double layer of vegetable. Add crushed paneer, homemade fresh paneer. Never buy paneer from outside, because what the outside paneer, what you get, it could be a synthetic paneer, or it could be a paneer where there's a lot of fat in it. So it's always better to make a homemade paneer. And if you do a little bit of pre-planning, I think it becomes more easier to maintain any kind of lifestyle disorders. You can take a mid-morning snack, any from the list, any kind of a low glycemic index fruit. Chapati, again, I said you can mix the wheat atta one day with Rajagira, one day with jaw, one day with juwar. Many people, they start making juwar and bajra rotis, and it's not very easy to be made by all. So they make those thicker versions. So that also releases, even millets are good. It's the demand of today. Narendra Modi is promoting a lot of millets, but you have to understand that even when you're talking about millets, you should know for which particular disease or which particular disorder you're trying to take in, because even millets do release carbohydrates. So it's very important for you to understand the balance when you are having any kind of a millet or a grain. When I talk about evening snack, it could either be it could be a chana, it could be a juwar puff, it could be a puff. If nothing, even Threptin biscuits, I've not written it here, but even Threptin biscuits is something which I would normally tell people to have. So if somebody is pre-diabetic and diabetic, there is a Threptin light which is available in the medical stores where it is for sugar free. There's no sugar in it. And dinner should always try eating it by 7:30, because according to the circadian rhythm, your kidneys and liver stop working by 6:30. Now when you're working, I know at times is very very difficult. So what you could do is, maybe the snack what you order from outside, you have to be very smart enough to understand what should you order, so that when you go home, maybe you can have a bowl of soup, or maybe some fruits with a glass of milk. But your mid evening snack before going home could be heavy. Now, very important topic is uh, teaching people how to read the labels. Now, after COVID, at least a little awareness is there among people. People have started reading the labels very well. And I always tell people that do not believe in anything that says fat free or that says sugar free, because wherever the free is written, and if you see in India, now the rule has passed where it has been told that the label has to be really visible, the main ingredient has to be really visible. Otherwise, it's written so small that we don't even bother to check the labels. So what should you check? The serving size. Now many a times you should understand the tactics what they play when you write on to the serving size of the particular packet what you are buying. Anywhere where you can see a word like sucrose, maltose, galactose, anything with OSC, if written in the food label, you have to understand that it has hidden sugars in it. So see to it that you don't fall in trap of anyone who is telling you that this is sugar free. Now, many a times I've seen people going in for brown sugar, or going in for jaggery, or going in for honey. Let me say they all belong to the same category, maybe one or two things. Let me finish the thing, and then maybe we can take a question answer round by the end of the session. So, Jason, I think I will answer to your query after I finish the slide. Uh, Now I'll be talking about the superfoods, which I'm basically I like dealing with something that's in the natural form, because that's really really very important. Uh, Anything that is supplements, of course, they are good, but I always believe in natural supplements, something which nature has given it to us, and we need to respect the nature. So Amla, I've already spoken to you about how do we consume it. You can either take it in a juice form, or maybe if it's not available in your state or city or country, you can take it in the powdered form. Now 1 to 3 grams of amla powder is really essential for people who are having the non-communicable disease, depending upon how your diet is planned. Now rajma, I consider it as a very good source of cholesterol lowering fiber, because it really helps, and it gives you a satiety feeling for a very long period of time. And it's universal. You can add it in salads, you can make soups, you can make tikkis, you can make it in the gravy form. That see to it that whatever you're taking it in the gravy form, the oil that you're using has to be comparatively lesser. Now the recommended dosage, it could be 3 bowls, around that is 250 grams cooked at least 3 times a week. Now, we already spoke about sweet potatoes, that it is one of the best things, very good to reduce the LDL cholesterol. It's very good source of fiber. And flaxseed is something which I would recommend people to include it in their diets. And one of the most important thing I would like to say is, many a times people, they are using sugar free without consulting the doctor, just to reduce the calories of the sugar. And I would say that instead of using a sugar free, go in for the stevia plant powder, because that is more better, because that is plant based, and it's more healthier. It is very very important that we understand how should we plan a diet and how we should take it. Now exercise, I've not mentioned it in my slide. It's very very important. It's one of the late it is like today's sitting is like smoking. It's worse than smoking because you're sitting for hours and hours on the office or maybe at home. So see to it, after an hour you just get up to maybe go to the washroom, or maybe drink a glass of water, or maybe just stand up and stretch a little so that your mind is alert. Try taking in more of staircase, park your vehicle a little away, so that you can do the walking, because today I see each and every house there's a two wheeler, and even a small child today is pre-diabetic. Maybe if it's a child is maybe 10 years old, it's not like type 1 where it's already there in their genetic disease, but it's there in, it's their lifestyle that is leading them to become a pre-diabetic. And once a year it is very very important to get all your blood parameters checked, because that really gives a clear picture of the body from inside. It's very, very important to understand the vitamins and the other parameters. Now, when I talk about attitude, I always tell people that we are what we eat and we are what we think. So today, in today's world, we are fully stressed all the time. It could be a work pressure, it could be being a perfect mom, or being anything to be perfect. We try to have a lot of stress also leads to cortisol, high cortisol. So many a times when people come to me and they say, ma'am, hum to chini bhi nahi khate, we don't even need sugar, then how did we get diabetes? So in case if your parents, or even if there is nobody in your family who is suffering from diabetes, but if you are under stress, you can come in this category. And the easiest way is just deep breathe. Now when I say deep breathe, you inhale in the counts from the nose, and the counts of 4. Hold as much as you can. You can start with just 5 holds, and when you're exhaling, you exhale it from your mouth, and try exhaling it very very slowly. I'm just going to show an example to you. So breathe in. So when you purse your lips and when you breathe out slowly, no matter how much ever stressed you are, by doing this, very very important, even many a times doctors are back to back seeing a lot of patients, and they don't get the time to eat properly and they're not hydrated. Trust me, just do this 1 or 2 counts and drink half a glass of water, and you're going to get totally energized. So I think I had tried to put everything in a nutshell, and explain it to you in a very easy manner. Now if anybody has some questions, they can ask me so that the doubts are cleared. Thank you.
So, Dr. Simi, um, there are many questions in the chat box.
Yeah, you can maybe read it and I'll try to answer them.
Yeah, 1 second. I'll just start reading. So, the first question is it necessary to remove skin of soaked badam?
No, this is something which is like a contradictory part, because some studies are saying that if you remove the skin and eat it, it has phytates. And some researchers are saying it's okay if you have it with that. So, what suits you, what your mindset is always been doing, please do that, and you will see the results coming, because everything is inside the mind. So there is
Okay.
nothing like a fix. There's no research where it is said that only soaked almonds with skin is better or without skin is better. But yes, soaked version is always better because it makes the nuts more easily digestible, because nuts are antioxidant. It gives they are antioxidants that really really help you for your body.
Okay. The next question is which cooking oil is safest?
Depend on which state you are staying. If you're staying in Gujarat, definitely if I tell you to have mustard oil, you would not know how to cook it. So anything in the kachi ghani. Now, when I say kachi ghani, when I say you can see if from where nowadays you'll see in small places in Gujarat, especially, there are people who have these oil mills, where they're producing it right in front of you. So you know what you're getting in. So the anything in your state, the kachi ghani oils are always better. Now, many a times it depends upon the smoking point, what you are trying to make. So, like in North India, you will see that people are more comfortable with the mustard oil. In Gujarat, it's more of the groundnut and the peanut oil. If you go towards Maharashtra, again, it's maybe a sesame oil, or maybe any seed oil. And if you go towards the south, it's the coconut oil. So anything, whatever you are having, any oil that you have, or maybe ghee that you want to have, everything has to be in moderation. Moderation is the key, and the new way of teaching people how to enjoy life by understanding the method of moderation.
Okay. The next question is paneer from cow milk or buffalo milk?
Now it depends that is the cow in your house, then I would say that it will make a difference, because nowadays whatever milk you get it in the packets, it makes maybe the fat content is a little up and down. But according to me, anything in which the milk, in which the cream is removed from top, is a milk which you can be used. If you're using a buffalo milk, see to it that the malai is removed from the top, and you can use that milk for making your paneer and your dahi. The same way, if you're using a cow's milk, you can, cow's milk, you will see very little fat is put. If you're buying a packet milk, you'll see very little of malai coming on top of it. So that is also, you can take that. So whatever you're taking, the milk has to be skimmed. It's hyped nowadays about cow's milk, and it's hyped about having an A2 milk. There is nothing of that sort. It's something that is a market strategy, according to me. And whatever I'm expressing today on this platform is my thoughts and my experiences, nothing that is against somebody or in favor of somebody. So I would suggest that whatever comes, like say for example, I buy Amul packets. I don't like the milk what they give it here in the open, because it gives a stink. I don't like that. So if I'm taking an Amul Gold, I see to it that I skim up the milk from the malai from top, and I use that for making my paneer and my dahi.
Okay. The next question is which variety of rice is best for pre-diabetics or diabetics?
See, nowadays, if you go on Google, and if you'll search, you'll get everything like a low glycemic index rice. So I would say that there is nothing like a low glycemic index rice. But yes, basmati is not has a very high glycemic index. So maybe a kolam or a jeera rice is much better. And do not wash the rice a lot in the beginning. But you can add excess water, and instead of overcooking it with the water, you can drain off the water and use the rice.
Okay. Which are the low glycemic index foods?
I will share the list with you, Preeti. Maybe you can share it with the people who
Okay.
are attending this. It's an entire list which I had. I will just put the slide on for you all to understand, which is the low glycemic index fruits. Okay, so if you see anything that is in the vegetables, most of the vegetables, they come under the low glycemic index foods, except for anything that is a root vegetable, which has goes into the moderate and high. Now, when you talk about fruits, apple is something which is in a low glycemic index. When you talk about banana, it is from a high glycemic index. If you talk about watermelon, it's again a high glycemic index. So you can share this this list with the participants, and it will help them to choose the
Yes,
list
yes, sure.
much better.
I'll share. Yeah.
Yeah, I think Jason wants to ask something.
Um, yes, Jason, you can unmute yourself.
Hello, ma'am.
Yeah, hi, good evening.
Good evening. So I just wanted to ask you, how do you change how can you make a simple starch to a resistant starch or a resistant carb? Is it like, because when I had gone to Canada, I seen people eating cold sandwiches and saying that this way they change the simple carbs to resistant carbs. Is it
Uh,
something
corn,
like?
corn actually comes in the medium glycemic index. Okay. Now, when you're talking about the abroad, the uh, if you see the activities, and if you see the temperature control, and when you see the things what you get there, that is why the maximum problems, if you I have a lot of clients from abroad who are having an IBS issue or having an obesity issue. The reason behind is they do not know the exact combination methods to eat. Corn, yes, is good. It is of the medium glycemic index, but when you combine it with something like a bread, then definitely I would want you to add another fiber for it, so that it makes your glycemic index low. So you need to add another vegetable which is lower than the corn glycemic index. So when I say lower, you can add carrot, you can add capsicum, you can add onions, and then you can have that sandwich. It will not allow the blood sugar spikes to take place.
Okay. Okay, ma'am. And ma'am, even cold rice doesn't allow your blood sugar to spike, like chilled rice from the fridge.
That's a very wrong concept. Actually, these are some of the, you can say, like people talking about. It's just like people talking about intermittent fasting. Okay, now when we talk about even intermittent fasting, it's not for all. Say for example, if a person is taking insulin and the person is doing intermittent fasting, there's a possibility that they can go into the hypoglycemia stage. So whatever you're doing, try to do it in a very method which you can really follow it for a very long period of time. Now, probiotic rice is something which I recommend, but not from the fridge. So, say for example, if you are a pre-diabetic, you can take a little bit of cooked rice of today. You can add one bowl of curd in it because it has a lot of probiotic bacteria, and you keep it outside in a glass vessel or maybe in a mud vessel. And the next day morning, take very little of fat, give a vagar of rye, and add what you call your yellow dal or a urad dal or a chana dal in roasting. Add a lot of vegetables and just pour it on this mixed rice and have it. It becomes a good fermented rice, which is excellent for your gut. So basically, your gut is something which needs to take care of, and mind and gut are interconnected. So if you are under stress and if you're going to take something which is of a high blood sugar, it's the food for the bacteria, for the bad bacteria in your body. So when we talk about curd, it should be at least had 2 times a day. Many a times it's a notion that it's in colder places we cannot have curd because it leads to the cough and cold, but that's a myth actually. It's really, really essential for you to have curd at least twice a day, no matter wherever you're staying. Especially, it has to be the homemade curd in India because outside, when you talk about Amul or when you talk about the other brands, they don't have the live cultures in it. In India, it's very easy to do it. You're talking about abroad, of course, yes, they do have yogurts where the live cultures are already introduced in that.
Okay, Dr. Simi, there's one question. Does cooking or boiling raise every vegetable's GI?
Yeah, it's like as I said, I've just given an example of carrot and beet. It's a very elaborate topic if we take it. So, if anybody has any queries to know more in details, they can just message me and take the number from you so that I can just share that content with them. So, anything that you are now, say for example, I will talk about potatoes. Now, potatoes boiled version is a little healthier, but when you fry it, of course, when you fry it in the raw form, it takes more oil absorption. But when you make a boiled potato ka sabji, you will see that the oil absorption is comparatively little less. So, or any vegetable that you take. Now, when you're talking about all the vegetables, as it is, most of the vegetables are low in glycemic index. So it's not going to go into a high glycemic index. It's only few selective vegetables which I mentioned, like carrot and beet, sweet potato, where it is changed. But if you talk about other vegetables, if it's on the lower glycemic index side, it's definitely not going to go into the higher glycemic index.
Okay, there's one more question. Other than stevia, any other sugar-free that you can advocate?
That is the only one that I advocate to people, or I tell them have your tea with a little bit of cinnamon in it. Cinnamon again has its own natural sugar. So no sugar free, but either a cinnamon in your chai. You can have maybe a little bit of ginger and cinnamon. You can put water to boil and see to it that you get a little bit of the sweetness of the cinnamon that is released. And of course, cinnamon is good for thinning the blood. It's an excellent blood thinner, and it's really good to even stabilize your sugar levels. So you can have a cinnamon chai or a stevia based chai, but not any other sugar free, which I would recommend.
Okay. So should olive oil be used for cooking?
Olive oil is not an Indian oil that needs to be cooking. If you see, the olive oil is actually the abroad based oil where they do not have so much of oil in their cooking, and then that is why when they eat only salads, they add the olive oil. But in India, हमारे हर एक चीज में everything has oil in it. Your dal has an oil, your vegetable has an oil. So why do you want to add olive oil for your salads, and why do you want to use it as a cooking medium? Because again, it's not made for Indian society or an Indian culture. So I wouldn't, that's my personal opinion, that I don't recommend olive oil at all.
Okay. So ideally, water should be taken how long after a meal?
Ideally around after 45 minutes, or maybe 1 glass before the meal, because it is said that when you have it half an hour before the meal, it helps for the digestive juices to help to digest your food, or maybe 45 minutes after the food is eaten.
Okay. Any food, fruit, or grain which can be which helps in revival of beta pancreatic cells?
No, that is something really complicated, because you have to see your vitamin B12 and vitamin D3 along with it. So that is, when you see that combination, no one single thing can produce anything in the body or make the body healthy. It has to be a combination of all the fruits or vegetables or grains mixed together to form good cells in your body.
Okay, so do you recommend to remove kanji after rice is cooked? Will it not remove the vitamins?
You can use that kanji for kneading your dough, or you can use it for your gravies, or you can use it in your dals. So you don't throw it away. You just tend to use it in another form.
So, what are the options for dinner if we take it after 11 p.m. or late night?
See, 11 p.m., depending upon what work profile it is, I will need to know the entire routine so that I can suggest, depending upon that. Just to give a random option, I would say to go in for a lighter meal. So it could be maybe a soup, a dal soup, or maybe a salad which is protein based. So maybe it could be a chana salad with lots of vegetable, a paneer salad with a lot of vegetables, or maybe a black chana salad with a lot of vegetables, a broccoli soup, something in soup or a salad in the night, because if you're going to eat any grain at that particular period of time, it's going to be very difficult for it to digest it.
Dietary restrictions for hypothyroid patients.
Now, hyperthyroid is something which is again, thyroid is related with the hormones. Hormones are related with the mind. So the basic, try to follow the 50-25-25 principle in your diet plate, and you'll see that most of the diseases, whether it is pre-diabetes, whether it's thyroid, whether it's heart disease, you'll see a lot of difference in your changes in your hormones and in your levels, because this is one of the easiest takeaways to follow is the 50-25-25 principle for your food plate. And thyroid, I would say that you can do a little bit of yoga and do a little bit of breathing exercises, because again, it's a mind related issue.
Okay, so we'll take a last question. Can fruits be eaten at night?
Normally, it can be eaten at night, but there has to be a gap of 1.5 hours after your meals. So, of course, fruits are one of the best things that can be taken, but if it depends, like in which category or a disorder you belong to, and which fruit are you choosing. So say for example, if a pre-diabetic has eaten a banana in the morning, then I would suggest to eat a low glycemic index fruit, maybe an orange in the night, because that is something with vitamin C. So any kind of a vitamin C fruit, or maybe a papaya or something, can be eaten, not a sweet fruit in the night before sleeping.
Okay, so there's still many questions coming in, so I'll message you all of them.
Yeah, sure.
So thank you so much for this wonderful session, Dr. Simi. And we were very obliged that you have conducted this session for us.
I'm happy to be on this platform, and thanks to the entire team of Amara Health for giving me this opportunity for being on this platform. Thank you so much.
Thank you. Thank you, participants. And this session is going to be available on YouTube for like forever for everyone to benefit. So thank you, everyone. Let's meet next Thursday. Sorry. Thank you.
Yeah, thank you.